at Food Smart, and I'm also a nationally registered and state of Florida licensed dietitian. I'm so happy to facilitate this conversation with you.
Awesome. Well, we're very happy to have you, Lorna, and all of your expertise. Just as a reminder, we are coming to you live from Food Smart, where we are committed to connecting people with nutrition support, including a personal dietitian and daily tools to make eating well simple. With that, we're going to get into the context of what we're talking about today, which is hydration. And hydration is something that we all know that we should be doing, right? As everyone's coming in, it's really hot. We know we should be drinking water. And, generally, I think people have a sense of how important it is, but I find that many people don't know why exactly it is so important or have just a basic understanding of water's role in some of the major processes in our body. So, today we're going to dig into that. And in addition to learning how you can assess your own hydration, some signs to look out for that indicate dehydration, and ways to work in more water. So before we jump in, I'd like to let you know that by attending this webinar, you will have a chance to win your choice of a $250 prize, either a $250 Amazon gift card or both a Fitbit and a glass meal prep set from Williams-Sonoma. All you have to do is book an initial or a follow-up visit with a dietitian by June 28th, so a couple of days, using the code WATER when you schedule. And as a reminder, visits cost as low as $0, depending on your health insurance. So I encourage you all to take a second and book that visit. My colleague Hannah is going to drop a link in the chat. And of course, reach out to her or any of us while you're scheduling if you have any questions. So thanks. Saw Hannah just drop that in. Thank you, Hannah. All right. Great. So, on the agenda for today, we are going to start with a brief overview of what water is. And then we will cover the role of water in the body. We'll look at how much water you need based on differences, types of conditions. We will look at monitoring hydration, understanding how to know whether you are hydrated or not, some ways to get more water, and then at the end, we will have a bit of a Q&A as time allows. All right, so what is water exactly? Let's get into that. Great. So water is a chemical compound. It is made up of two elements. So if you think of the periodic table, lots of different elements. Water is made up of one oxygen atom and two hydrogens. So you get this formula H2O, which most of you are probably familiar with. Water has some really interesting physical components. It's a colorless, tasteless, and odorless uh, compound. And it exists in three states. So it's can exist as a solid, as ice, liquid water, and then also as a gas, as a steam or vapor. And water also is a polar molecule, which means that it has this kind of partial positive charge on one end and a partial negative charge on the other. So regardless of whether you have any background in chemistry, just know that that's a really important thing chemically, and it makes water a really dynamic and unique substance that is really useful, particularly in the body, but also for all life on the planet. Water is incredibly important in nature. It covers about 71% of the Earth's surface. There's an interesting, I guess, visual going around of the Earth in a way that we don't typically see it, which shows to scale, really, the Pacific Ocean can cover the entire view of the Earth, depending on where you're looking at it from. So that just shows kind of how vast the ocean is. Um, and water is essential for all forms of life that are known to us. So really, really critical. Um, yeah. So we are made of water. And you can see in this image that when we are born and kind of during childhood, we're between 70 and 80% water, and that amount decreases as we age. So in adolescence and adulthood, we're between kind of 55 and 60, and then in older adulthood, we may be at about 50%. So we can see the evidence of this in things like our skin. It's pretty clear there. If you think about a baby's skin compared to the skin of an adult, right? Kids are also really bouncy. In the sense that they can kind of jump and fall and not seem to get hurt so easily. And some of that has to do with the water providing the cushioning around their body. So, We also see that most of the water is in the cells of our brain, heart, and lungs. So those really vital organs. And then, of course, our blood as well. So within the body, as well as just in the world, water is essential for life. Great. And now we're going to get even more specific and talk about the role of water within the body. And there's so much of it in there, why is that and what is its role? We're going to look at that in some of our critical functions like digestion, metabolism, and then detoxification. So we think of water as only having physical consequences a lot of times, but actually water plays a role in our mental health as well as our performance or how we're able to function day to day. So I've listed a couple of physical benefits here, but we'll really get into those a lot more in depth shortly. But this does help. It helps you absorb nutrients from what you eat. It helps maintain your blood pressure. It helps keep your metabolism healthy so that you're using the energy that you're consuming, and just really so much more. On the mental health side, remember how reliant our brain is on water. Staying hydrated helps with cognitive function and concentration. It reduces the risks of headaches and migraines. It improves mood and it reduces fatigue. So, really helps with how we're feeling emotionally and cognitively day to day. And then on the performance side, it can also help with endurance, preventing fatigue. Its role in electrolyte balance can prevent cramps. Its role in metabolism can help your muscles utilize the energy that you have in your body. So, yeah, you can see that water's role in our lives is really 360 degrees. It's important for everything. So, just this little overview, I think, is kind of helpful to see that. And now we're going to dig into a few key areas related to nutrition. And those are one, how we digest our food. Two, how we use that broken down food or metabolize it for energy, and then water's role in detoxifying or removing waste from the body. All right. So water's role in digestion starts as soon as we put food in our mouths. It's a component of saliva, which has enzymes like salivary amylase that breaks down food, specifically carbohydrates, as we chew it. And water also activates enzymes, which are chemicals that break down different compounds of our food throughout the digestive tract, including the mouth, also within the stomach, the pancreas as well. And in the stomach, we have what's called chemical digestion, where we have our stomach acid doing its thing, as well as a bunch of different enzymes. And water acts essentially as like a key that unlocks those enzymes so that our food is actually able to use them and be broken down. So it's really important both in the mouth and the stomach, and then also within the intestine. So helping move food along regularly, continuing to dissolve those chemicals and components, and then aiding them in passing through our intestine and into our blood. And then, throughout all of this, it's really important to maintain what's called our mucosal lining. That is what coats the inside of our GI tract. And you can imagine all of the wear and tear that this gets as we're eating every single day. So keeping a healthy mucosal lining and protected, and all of that protected is really essential. And water is a primary component of that lining. So hydration plays a role there too. Great. So once our food is digested, meaning it's all broken down, that's what digestion means, it enters the bloodstream. So, adequate blood flow and pressure are also reliant on good hydration, by the way. So as it's entering the bloodstream, water comes into play again. Where these nutrients are transported to via the blood are all around the body, depending on where they're needed. And when they arrive there, they enter our cells where they are metabolized, which is another word for just broken down, to form energy, or ATP, it's called, adenosine triphosphate. It's the currency of energy that our body uses to do everything, really. And that's at a cellular level. So water is a critical component of this process. So that without it, actually, say in a state of dehydration, the cells are going to be less efficient or inept at creating ATP and providing energy for the body. So it's really serious. We think about metabolism in terms of how slow or fast, usually, right? Meaning like a metabolism that breaks things down or uses up our food slowly, presumably maybe makes it harder to lose weight, for example. Or if that process happens quickly, maybe weight loss might seem easier. That's kind of how we generally think of metabolism. So in the context of weight loss, or even just feeling energetic and good, hydration is super important. So, Lorna, anything to add to that piece?
Yes, you did a great job explaining that, but I like to emphasize that metabolism involves two types of processes. The catabolism, or breaking down, as in the example you give with digestion, when nutrients are broken down, transported, absorbed, and all of these processes require water as the medium for these things to occur. But secondly, metabolism involves anabolism, or the building up or synthesizing process, as in the production of energy in the form of ATP, which is absolutely needed and used by the cells of the body. And again, the importance of water here is in the role of phosphorylation, the phosphorylation process supplying electrons and hydrogen ions that are being consumed in the process, where we're converting adenosine diphosphate into adenosine triphosphate, which is absolutely needed for the cell. So when you're feeling tired, and even in the example with weight loss, etc., think, I need to be hydrated for these processes to work efficiently.
Yeah, 100%. Thanks so much for adding some color to that. I agree. It is really helpful to think of kind of the two sides of metabolism. And yeah, and the example of weight loss to me is really interesting because, people usually focus on diet, right? And they're like, yeah, we know we should drink water, but actually that's so integral to having that function properly. So thank you. Great. So now we'll look at detoxification. So once our body has broken all of that down and used up the nutrients from our food, there are still some things left over, right? This can be waste, just things we didn't need to use if we consumed something in excess. Our body's really good at balancing and knowing what it needs, and it gets rid of what it doesn't. It can be toxins, and those can be kind of objectively toxic things that we have consumed, or an excess of waste products in the body can be toxic in some circumstances too. So all of those are kind of looped together or lumped together in this term toxins. It could also be extra water that isn't needed for balance, things like that. So all of that just really needs to get cleaned up and removed from the body. So water facilitates many of these processes, helps our kidneys filter out toxins and waste, and dilutes it to be removed as urine. And it helps our liver metabolize toxins and also forms bile, which further breaks down toxins and waste and removes that via the urine. And then there's also sweating, which is maybe the most obvious one of the detoxification pathways that involves water. But the skin is a really important detoxification organ, removing those toxins as well as regulating temperature. So you can see this process from, taking a bite of food to digesting it all along the way, to getting the nutrients out of it, to using those nutrients in the cells, to removing waste. This whole kind of process is reliant at almost every single step on water and good hydration. So you can really see the importance there. And then lastly, outside of those key processes that we discussed, there are just a couple more that rely heavily on water that I think are worth just calling attention to. So one of those is circulation. So water is obviously a major component of our blood, right? So having water balance in the body helps our blood pressure stay regular, helps our blood flow properly, delivering those nutrients and oxygens to cells, and then removing waste products. It's really just the transport system throughout our body, and it's really essential that that is working well. I mentioned this a little bit earlier, but cushioning and joint, or cushioning as well as joint and kind of tissue health. So in the context of like a child, but also as adults, having good hydration helps cushion our joints, which are things that kind of deteriorate with wear and tear and age. So really important to maintain good hydration and good lubrication within our joints, just for daily functioning and movement. It also cushions vital organs. So our brain, I talked about that, our spinal cord, all those are surrounded by fluid, cerebrospinal fluid, things that cushion those really essential organs in our body as a protective mechanism. Temperature regulation. Water helps keep our body temperature stable by sweating and breathing. This also comes into play with electrolytes a bit. So as we're sweating a bunch, there's an balance that needs to happen between kind of water and electrolytes, which are kind of the salts you can think of within our body. And so, as our body's responding to heat, like right now, or exercise, we're sweating, we're regulating temperature, or if we're really cold, those levels kind of flex. And so, maintaining enough good hydration is important to make sure that that stays balanced and regulated. And then maintaining cell function. So we talked about how when you eat, nutrients go through your blood and into your cells. Well, your cells, if you remember from biology class, have all of these little organelles in there, all these functions, things going on inside the cells. Those are all sitting in a certain place within something called cytoplasm, which is like a liquidy substance. So to keep everything in place and functioning properly, we need to have enough hydration to have adequate cytoplasm so that everything is working. So again, just like the oil, the fluid that makes everything work in our bodies. And then balance. So I touched on this a bit with electrolytes, but also something called acid-base balance, pressure balance across membranes. Everything is really reliant on water. So yeah, that now that we've kind of looked at the basic science of how vital water is in our bodies, I am going to turn it over to Lorna, who is going to talk about just how much water we need, how to know if we're hydrated, and some practical ways to fit in more water. So, Lorna, it's all yours.
Thank you, Lindsay. Yes, again, as Lindsay said, we saw how vital the role of water is in all our bodily processes. So it is as important to examine what our needs are. So, how much water do we actually need? Now, individual water needs can vary with a number of factors, such as age, as you saw in Lindsay's demonstration, gender, activity level, and of course, environmental conditions. For adult males, the recommendation for total daily water intake is 15.5 cups. Which translates to about 124 fluid ounces. Now, one point is that this total daily water intake incorporates pure water as well as other beverages and moisture from food. For adult females, it's 11.5 cups that's recommended of this total daily water intake, amounting to about 92 fluid ounces. Now, typically, of this total daily water intake, our foods, the foods we eat, make a contribution of about 20% to this water intake. Now, there's some other groups in terms of considering how much is needed that we need to pay special attention to because they have additional requirements, such as pregnant and breastfeeding women. Um, in the pregnant woman, for instance, the blood volume expands during the course of pregnancy, and there are additional needs due to amniotic fluid, etc. So it is recommended that the pregnant woman intakes 12.5 cups total daily water, which amounts to about 100 fluid ounces, and the demands of lactation as well also requires that breastfeeding women consume 16 cups of total daily water intake, amounting to about 128 fluid ounces. Now, there are some recommendations for children at certain ages. So children 4 to 8 years, for instance, they require 7 cups total daily water intake, and boys and girls ages 9 to 13, for instance, require 10 cups and 9 cups, respectively. Now, the question remains, or the question one can ask, can we intake too much water? I know some people who really love drinking water, as well as I know those who don't like it. Can we intake too much water, and how much is too much? Now, like it is for some nutrients that we consume, there are no tolerable upper limits that have been identified. And so with water, nothing has been set as a upper limit, so to speak. But we do have things that cue us into what can be excessive. So, for instance, the kidneys excrete 3 to 4 cups of water maximum per hour. And therefore, there are risks that would be associated with overhydration if this amount, if it's increased hourly, if these intakes of water are increased hourly, much above what the kidney is able to excrete. Now, some studies have actually shown that intakes of 13 to 17 cups in a few hours um, can be associated with nausea, headaches, and confusion. And I find it very interesting from those studies because these are some of the same uh, symptoms and signs that occur when people are dehydrated. And it just attests to our bodies and how they really fight to maintain homeostasis at all cost. Um, More than 4 cups per hour in healthy adults on a regular basis can be deemed excessive. So in general. Now, I have to mention other special populations in terms of watching a water status, hydration status. Caution needs to be taken with special groups such as endurance athletes and persons with kidney disease. Now, I'm not an expert when it comes to the endurance athlete, but I can say firsthand for patients with kidney disease who particularly are on dialysis and who I've worked with, they have increased mortality rates associated with overhydration. As a matter of fact, it becomes a problem if they, between dialysis treatments, if they have gained too much weight, then the machine has to work very hard to take off that water because the kidneys are not functioning to excrete potassium and other things that it has to excrete. It's not working hard enough. It is not able to function to remove the water that it needs to remove. So it causes a problem. And these patients are literally drowning in water when they do not adhere to the fluid restrictions. So I wanted to mention that because that is very important. Lindsay, do you have anything to add at this point regarding, say, hyponatremia?
Yeah, thanks, Lorna. All very interesting. I can comment a bit on the endurance athlete piece and why hydration is so important, but also why overhydration is an issue. So obviously, with the increased sweat output and breathing, we're going to be losing more water. And so everyone thinks, I got to chug a bunch of water to make sure I stay hydrated. When you're doing endurance sports, when you are exercising, and you can simply think of that as maybe an exercise that is consistently longer than 90 minutes, that's when you're going to want to introduce electrolytes into your water. Your body typically has enough reserve electrolytes, so things like sodium, potassium, magnesium, chloride, in reserve for a time less than 90 minutes. So you don't really need to think about it. If you're just kind of going to the gym for 30 minutes, you can, but it's not super necessary. However, if you're exercising for longer than 90 minutes, you do need to start incorporating electrolytes rather than chugging plain water. And the reason for that is back to that kind of electrolyte balance that we talked about. You're at risk for something called hyponatremia, which is essentially like a too much of a dilution of water in your body. So your electrolyte balance is thrown off. You don't have enough electrolytes because you can't replenish them quickly enough after you've depleted your stores. And so you need to be adding those back in to help maintain that balance if you're exercising for longer than 90 minutes.
Thank you, Lindsay. Thank you so much for that. I think our next step then, now that we have looked at the how vital water is and how much is needed and special needs, how can we make sure that we are getting what's needed? How can we monitor our hydration status? Now, monitoring hydration is important to everyone, but particularly for athletes and persons who are very active. Now, ways and very simple ways to assess hydration status that we all can utilize include, for instance, monitoring your urine color. regularly. Darkish yellow, amber colored urine often indicates dehydration, and a pale yellow straw color it's indicative of adequate hydration. Now, body weight. Also, as I mentioned earlier with the example of the dialysis patient, body weight for all of us, rapid changes in body weight can also be an indicator of hydration status. For instance, a 1% body weight loss is associated with a little over 32 ounces of fluid deficit. So it works both ways. We have to watch to make sure that we don't have a deficit. But in the instance of the dialysis patients that I mentioned, persons with kidney disease, they have to monitor to make sure that the weight isn't increasing tremendously, because it's usually indicative of how much water they have taken in excess of what was recommended for them. Osmolality or urine concentration is also another way to measure. And this is used clinically in clinical settings because it requires equipment. A normal osmolality is around 500 to 850 milliosmoles per kilogram of water. But as I said, this is done more in a clinical setting. If that is suspected, that can be done by clinicians. Another simple way to monitor would be our simple thirst sensation. It's a very simple way to assess hydration. Feeling excessively thirsty is a very good cue, an indicator that you might be dehydrated, and to pay attention to those cues. So for athletes and active individuals in particular, combine urine color, combine body weight changes, combine thirst sensation, and make an assessment as to what your hydration status is. For everyone, it's important for us to stay well hydrated by drinking fluids regularly and heeding signs of dehydration like thirst, those thirst sensation cues, dark urine or urine becoming darker than normal, and decreased urine output. Those are very vital indicators. Okay, so now that I have mentioned that, I want to actually address some of the actual signs of dehydration. And I've divided it into two portions. First of all, mild to moderate dehydration. And that includes things like, of course, thirst, dry mouth, decreased urine output, and that progression into a darker color, yellow urine, dry skin. You can see it in the skin. Then it's often accompanied by headache, fatigue, weakness, dizziness or lightheadedness is another sign, and muscle cramps. And you can see the connection there as a sign of dehydration with that fatigue and weakness. Takes us back to that adenosine triphosphate and how important water is in that phosphorylation process that allows this energy to be ready in that form so that it can be utilized by the cell. Okay, so what are the signs then of severe dehydration? When dehydration has progressed and has become severe, there's little or no urination at all. There's extreme thirst, sunken eyes. So you physically can see sunken eyes. The skin becomes shriveled and dry to the point it lacks elasticity. Often accompanying this sequel is rapid heartbeat and labored breathing, fever. Again, that attests to that role of water in temperature control and for the body and cooling. Delirium or confusion can occur with unconsciousness. So you see that these signs and symptoms of and manifestations of severe dehydration They are not to be taken lightly. These can be fatal. So very important to pay attention to what's going on with these. Now, I want to address some additional signs of dehydration in uh, special groups again. Special because they are so susceptible. Now, additional signs of dehydration in infants and young children would include, for instance, in babies, you might see them trying to cry, but there are no tears, there are no visible tears. Dry mouth and the tongue is dry. A sunken fontanelle, that soft spot on the baby's forehead. And there's lethargy or irritability excessively. So these are things that occur. Now, why it's so important to heed any signs and symptoms in an infant? Um, Remember that babies or infants, body water content is highest in infancy, and it declines with age, as Lindsay showed in the diagram earlier. However, medical conditions, inadequate and inappropriate feeding practices, diarrheal diseases, for instance, among others, can put infants at high risk. Now, this is compounded by a few facts. Um, Infants have a greater baseline fluid requirement due to higher metabolic rates. Their metabolic rates are very high in infancy. They also have a higher evaporative loss due to a higher ratio of surface area to volume. And of course, their inability to communicate their thirst and to seek out fluid. So very important. This puts infants at one of the most susceptible life stages that we have with regard to dehydration. Now, our elderly, likewise, it's very important to monitor hydration status in the elderly. Persons over 65 years and older, they have less water content than younger adults and children. Again, as you saw in that diagram that showed how our water content declines with age, and that's naturally, this happens. But susceptibility to dehydration in our elderly can result from inadequate water intake or excessive water losses. And this can be compounded by possible decreased kidney function, which happens after age 60, which affects fluid levels, and also reduced thirst sensation that occurs naturally in the elderly, which can prevent an already low water supply from being replenished. So again, this places the elderly in another susceptible category, and it's so important to monitor their hydration status. As I said before, caution. Severe dehydration is a medical emergency. It can result in seizures, brain damage, and death, of course, without prompt treatment. So the advice is to seek immediate medical care in instances where these signs and symptoms are noted. Now, the best part of this for me is putting it into practice. Now that we know the importance and we know how much and we know all the signs and how to monitor, etc. How can we get there? What are practical ways to get more water, particularly for those of us who do not like drinking pure water? Okay. Now, I would say that the key is to make drinking water more convenient and more enjoyable by finding strategies that work for you and for your lifestyle, and taste preferences as well. Okay, so some practical things actually that one can do. First of all, to make sure you have water. Carry a reusable water bottle or container with you at all times, which you can sip from and you can refill, etc. So that's number one. And these days, it's so easy with our smartphones that we can set reminders or we can do it on our laptops, our computers, setting hourly reminders to drink water at certain times. Now, some of the practical things that I like as someone who does not necessarily like just drinking pure water all the time. So you can actually infuse your water with fresh fruit like lemon or lime. Um, I've had these slices of lemon infused in this water for a little while, so it's saturated and the flavor is great. So that makes it so much more palatable. Um, you can also do things like strawberries, cucumbers, etc., to give other natural flavors. Now, for those persons who are managing weight and intake of simple sugars, you can actually reduce sugar beverages like soda and juice by just simply using water and doing certain modifications to them. This helps to eliminate all that empty liquid calories that you're consuming when you consume sodas and juice drinks and things of that nature. Again, for those who are interested in weight management, a good technique is actually to drink a glass of water before each meal. So when you either go to a restaurant or even at home, take a glass of water before your meals. This allows you to feel fuller, and it helps you consume fewer calories, contributing to that weight management. Now, include foods. We have so many foods, as I mentioned earlier, that contribute to our total water contribution. Things like cucumbers, tomatoes, green leafy vegetables, watermelon. These things can be incorporated as well. These strategies. One of the things that you can do instead of using ice cubes from your refrigerator, you can actually freeze things like berries, strawberries, blueberries, etc., and drop them into your glass of water. It cools the water down, but it also, again, some flavor for those of you who don't like just plain old water. You can try sparkling and mineral water if you don't like the taste again of plain water. And I'm not advocating for any particular brand, but there's so many of them out there, and you can try them. I would say go for something that has a hint of lime or lemon. It's all about making it more palatable that you would love consuming it. Um, Lastly, it's a good practice to drink a glass of water first thing when you wake up in the morning and last thing when you go to bed. This actually helps kind of bookend your day with hydration. So these are my recommendations to you. And I would love to say, let's continue or start drinking to adequate hydration and to good health. Cheers.
Cheers. Thank you so much, Lorna. That was super insightful and lots of really great practical tips. And I love that you're drinking lemon citrus water as well, practicing what you preach. So
All homemade. Yes.
perfect. Okay, great. So, we've gone through a lot of stuff today, lots of science, lots of really practical tips. Hopefully, this has all been really helpful. If you have found that any of this resonates and you are looking for personalized guidance or on fitting, more water into your day to day, as well as just how to eat to best meet your unique goals. Again, meeting with a registered dietitian who is a nutrition expert is a great next step. They will look at your goals alongside your health history, your preferences, your budget, your schedule, and they will come up with a plan that is specific to you. So again, make sure if you're interested in that, make sure you schedule within the next 48 hours using the code WATER so that you're entered to win that $250. Great. So with that, I think it is time for our Q&A. It looks like we have a little bit of time left. And Lorna, I have dropped the questions as you were going through. I pulled all the questions into our shared doc. If you want to look just at the bottom there.
Okay, I'll take a look.
Great. So yeah, if you have any additional questions, please drop them in now. But I can go ahead and answer one, Lorna, while you're taking a look through.
Okay,
So
go ahead. Yes, sure.
cool. So someone asked, they said water is important in hot weather, but what about cold weather? So I just want to reemphasize, like, yes, as Lorna pointed out, water, there's a daily kind of goal for different persons for the amount of water that you should consume, and that is regardless of what the temperature is outside. Heat, however, as well as high activity exercise means that you're losing more water through sweat, but also your breath if you have rapid respiration or if it's just hot out, you're losing more water, even if you don't feel sweat on your skin. So, when it is hot, you may just want to overcompensate. So, it might be a little bit above whatever that kind of daily baseline limit is if you were in some of those conditions. So, just wanted to point that out again. Lorna, any you?
Yes, I see a quest. Someone asked, "Do you recommend a water journal for tracking water?" I think that is such a great idea. Just as we would recommend, and I am, a registered and licensed dietitian, as I shared. Usually, when I meet with clients for dietary concerns, and of course, water is a part of that, I have them track what they eat, how much, etc., on a daily basis. It's amazing how tracking and journaling causes so a heightened awareness of what you're actually doing and what behaviors need to change, and also in terms of quantities, what might need to be increased or what might need to be decreased. So I think that's an absolute great idea for journaling and tracking water intake daily to make sure that it's in concert with recommendations for your gender, for your age, for your activity level, etc.
Yeah, that's a great idea. And it's a follow-up to that. Someone was asking, they take a vitamin B mix, which turns your urine really bright yellow. So it's hard to get that visual indicator of whether you're hydrated or not. So in that case, I would suggest focusing on something like tracking or some of the other cues that Lorna talked about, just till you get a sense of what feels right or what good feels like. So knowing whether, you need to drink two big water bottles a day to get your recommended amount in, can be helpful to focus on some of those others if it's not always clear.
Yes. And the dietitian in me, I want to piggyback off of that. I take a vitamin B mix. And I don't know why specifically vitamin B as opposed to a multivitamin, multimineral to supplement the diet. There may be a reason, so I'm not knocking that. But again, vitamin B, but all the B complex vitamins as well as vitamin C are water soluble. So they are, if you are consuming excessive vitamin B or vitamin C and you are not in a deficit for those vitamins, what your body does is going to excrete it. So that nice bright red in in the urine, or bright yellow or whatever, is just your money being flushed away. So
Yeah.
just be mindful.
Yeah. Yeah,
Okay.
that's exactly right. So just yeah, unless you're in a deficit, right? So if you're
Yes.
deficient in vitamin B or whatever, then it's certainly worth
Yes.
it. But otherwise, it's just an expensive highlighter.
Yep.
Um, Great. There was another question someone asked about recommendations for a good homemade electrolyte mix versus buying certain powders. So I have a little bit of commentary on this. There are multiple electrolytes, potassium, magnesium, sodium, chloride, manganese, even, and they're needed in certain ratios. So you don't want to, for example, add a bunch of table salt to all of your food and water and whatnot. A pinch of sea salt, however, does have most of those electrolytes in certain concentrations. So you could think about doing that. Again, I would only recommend that, maybe not on a daily basis, but if you're overexerting yourself, you're in the sun, your kids are playing sports, things like that can be a good thing to do. Also, coconut water has a lot of natural electrolytes in it, so it can be really great to add that in or just drink it by itself, sip on it, add a little bit of ice. And then adding in fruit. So fruit has different electrolytes in it, specifically bananas. I know that's not really something people mostly add to water, but even things like strawberries, watermelon, they all have different kinds and amounts of those electrolytes. So, if you really wanted to make an electrolyte cocktail, if you will, I think adding some different varieties of fruit, a little bit of coconut water, maybe a little tiny pinch of sea salt, would be a good thing to try and sip on.
Okay, I see one here. It's marked Lindsay, but I'm going to address it. Does coffee dehydrate you? What about beer? Um, okay, both caffeine and alcohol can. Oh, okay, Lindsay, you did it. Sorry,
No,
you
go
did.
ahead. I was just putting some notes down as we were
Okay,
going through.
okay. No, I was actually going to say that yes, caffeine and certain teas and alcohol, they all act as diuretics in the kidney, so you produce more like dilute urine. So it does as a result of that diuresis. Yes, it can result in dehydration. So those are things to watch, and particularly if you're using them in large amounts, and you're a regular drinker of alcohol, beer, and other types of alcohol, and you are a frequent coffee drinker, several cups a day, etc. So those are things to watch for in terms of your hydration status, because they
Yeah.
are diuretics.
Yeah, exactly. A little trick I like to do because I do drink coffee, and I don't really drink alcohol, but many of my friends do, is the alternating method. So if you have one beer, you have one glass of water. If you have one cup of coffee, you have one glass of water. So that's also something you can try. Or are there any others you feel
I'm
take a look at?
scrolling. Let me see. Someone mentioned, and I know, Lindsay, you did answer something similar. Does the temperature of water affect how your body processes it? Um, Not specifically. I don't think. I mean, the body is going to utilize the water for the roles that it serves and the functions in the body nevertheless. However, drinking water at certain temperatures could either be not palatable or can just shock your system if it's excessively cold, etc. So, but in terms of what it will do in the body, it will still do what it has to do.
Yes, 100%. Water is water. I would
Right.
say if you're having trouble fitting it in, do it however you can. But yeah, as Lorna pointed out, our bodies are 98.6 degrees roughly. And so if you're dousing it with freezing cold water, it is a little bit of a shock and it can cause some digestive maybe symptoms, but um, usually pretty mild and it doesn't affect the hydration role. All right. Let's see. I know there were just a couple more. We have another minute or two. Um,
There is one, while you search, Lindsay, as the metabolism slows with age, do seniors require more water?
Mm.
Um, Not specifically, not more than is recommended for adults. Um, an adult male or an adult female. So in that perspective, from that perspective, no, more is not required. I think what is required is monitoring, making sure, because what does happen in addition to the slowing of metabolism and the lower water content within the body is that the elderly, they lose that acute taste sensitivity. Um, thirst sensitivity that we all have. So it gets, less and less as they get older. So that can be something that jeopardizes their intake because they don't feel thirsty. So it's good to have someone, helping them monitor. So that would be my advice. But it's not that the requirement actually increases for them.
Yeah, well said. Well said. Okay. I know some people are saying their goodbyes. I will answer one more question and then I think we can close it up for the day. So there's a couple questions that came in just recently about liquid IV specifically, as well as hydration gummies. I don't know what brand that is necessarily, but just assuming gummies. The only thing I would say for those, and they do have a place, especially if you've been sick, where sugar can be helpful, but those things generally are pretty high in sugar. And so that would just be a little bit of a watch out on a day-to-day basis. It's probably not something that I would recommend having a ton of. Again, if you've been ill, if you had like a stomach illness or something, or you've had a lot of diarrhea, maybe you're severely dehydrated, it can be really helpful in those instances. But generally, I would stick to kind of like the less sweet, more kind of coconut water fruit side of electrolyte mixes. So that is what I would say. So, Lorna, anything to add before we close down?
No, I would just say pay attention to those cues. Pay it, particularly if you're very active and in the weather that many of us are experiencing, during the beginning of the summer. Um, and just keep drinking adequately to good health.
To good health. All right. Thank you so much, Lorna, and everybody for attending. Hopefully, you all found it helpful. And I think Hannah pointed this out, but this will be available on our YouTube channel. We'll send out a link in a follow-up email the next day or so. So thank you guys so much. Have a good one.
Thank you.
Bye.